Well, good afternoon, folks. Sorry to get started so late. I'm Al Mattingly, the Daviess County Judge-Executive, and I'm here today to give an update for Daviess County on COVID. And I have a very special guest, my good friend Chad Benefield, a radio personality and all of that. So it's nice to have him with us. First, I'm going to give you an update, and then I'm going to bring Chad on because he experienced COVID. And he's going to tell us what it's like for a younger person to have COVID. Since I had that old dude, former Judge Executive Kelly Thurman on, I did have his very beautiful wife Sharon with us. So anyway, Chad, just bear with me for a moment.
Sure.
The latest report from the Green River District Health Department said that in the grad district, in the 7-county district, we had 264 additional COVID cases today and 4 additional COVID deaths. Those COVID deaths, the 4 additional, are here in Daviess County. And I mentioned to somebody today that for the last month or so, it just seems like to me that every time I go to the obituary page, it's not just one page, it's 2 and sometimes 3 pages. So if you would join me for just a second, and let's remember those people who will not be with us for the rest of this year. Okay, thank you. And I noticed that, or if you noticed, I took my mask off. I try to start the program every Wednesday with the mask on because I want to show you and tell you, convey to you how important that mask is. The mask is not going to stop you from getting COVID, believe it or not. But the mask is one of the few protections that would help prevent you from getting it. I mean, everybody, you can wear that mask and your folks around you wear the mask, but there are other things that we have to do, which is social distancing, avoiding large groups, large crowds, and making sure that you wash your hands, just like Mama told us when we were growing up, because those hands, hand to mouth, hand to nose, hand to eye, it's a surefire way to spread COVID. We reported 48 confirmed cases that are currently in the hospital in the grad region. 4.5% of the total cases in grad, and there have been over 15,000, 4.5% of those have required hospitalization, and there have been a total of 258 deaths in the grad region. Now, let's talk about Daviess County in particular. As of today, this morning, we reported 6,820 cases. 4,909 cases have recovered, and that's good news. 24 cases are currently in the hospital. 266 of those cases that we have had ever were in the hospital. And unfortunately, we've had 113 deaths. If you take all that, active cases minus recovered cases minus deaths, we're now right at 1,800 active cases in Daviess County. So that means there are at least 1,800 folks who are actively experiencing COVID and have not recovered. And as I talked to you about my memories back in June and July, at any one time back then, if I had double digits, if I had 10 or 12 or 13, that was a lot. And now we have 1,800 folks. You can be tested. The Daviess County Health Department runs a testing site. And in Daviess County, at the Daviess County Health Center, on the 20th and 27th of January, between 11 and 1:30, they will test. You can also get a flu shot there. What I would recommend that you do is go to www.healthdepartment.org. That's www.healthdepartment.org. And you can make appointments to be tested and get the flu shot. There are flu vaccines being administered now. As you're aware, the group 1A, which are nursing homes, assisted care, living facilities, and frontline healthcare workers, 1A has been out there for 2 to 3 weeks. 1B was opened up last week at about the middle of the week, and you now can try to make appointments for your COVID shot by going to, if you have My Chart, you can go on My Chart. That's what I've got. It reports all the kind of tests that you had, but you can also make an appointment to do that. One of the problems that we still have is the state of Kentucky, according to the governor's report this morning, gets about 50,000 vaccines every week. And unfortunately, that's to go across 4 million people. And he was asking, Dr. Stack was asking, and I would ask that you just be patient. He said that while 1B is opened up, he thinks 1C, which would be those 60 and older and essential workers, will open up sometimes into February around the 1st of March. That doesn't mean that you won't hear or you won't find where somebody gets on Facebook or some facility and they say, we have thawed X number of vaccines, doses of the vaccine. We can only use half of that. We don't want it to go to work or to waste. First come, first serve. And I think that's happened a couple of times in our community. It's happened a couple of times throughout the state. The goal is use 90% of the vaccine within 7 days of receiving it. So the other couple of things I wanted to talk to you about that we talked about with the governor this morning is the challenge that is occurring if the new administration coming in decides to release all vaccine. What happens to those folks who have already had a shot? As a matter of fact, being one of those seniors and one of their old folks that I keep talking about, Chad, you're young compared to me. Jordan, bring up that picture, and folks, don't be scared and don't leave, but I want to bring you up a picture to show you a gentleman. Well, I don't know that he's a gentleman, but there's me receiving my COVID vaccine, my initial vaccine, the Moderna vaccine at Owensboro Health. All right, that's enough. I've already seen we have fewer and fewer participants. So I just wanted to tell you, and again, I said when my turn came up, and I'm 70 years older, I'd roll up my sleeve and they could give me the vaccine, and I took it with no fear. My reaction to it was none. I had no reaction to it other than the next day when I was talking to our county treasurer, I was leaning against the door frame and I go, wonder why my shoulder, it's a little tender right there. Now, my wife had a little more of that reaction than I did, but both of us are just fine. I think Judy is a little meaner, Chad. I need you to call and check on her for me. But I await the moment for me to go and get my second dose. The good news is that the governor said that they believe Johnson & Johnson is about to ask for a emergency use certification from the FDA. And Johnson & Johnson is a one-shot vaccine, meaning that you don't have to take the first one and wait 3 weeks if it's Pfizer or 4 weeks if it's Moderna. So AstraZeneca, the best I remember, AstraZeneca is also a one-shot vaccine, and they received emergency usage in England, in Great Britain, but they have not received it here. There are 1,400 registered vaccination sites set up, but as I said, 50,000 doses a week. So you'll notice there's not a lot of vaccine that's out there and being shipped to places. I asked Clay Horton this morning how I could best describe the vaccination schedule and what was happening right now. I gave him a rather colorful term that I can't use here in front of Chad's young ears. He said, Judge, that probably describes it best, but I would say that it's an evolving situation. I would continue to urge you to look at the Owensboro Health's website, the Green River District Health's website, our website. I guarantee you when Chad gets back to work, he'll be the first to let you know if a group is open or if there's vaccine out there. You just have to be on your toes. You have to be nimble enough and be ready to react if your turn comes up. I would tell you that we have been in contact with the state regarding a large drive-through vaccination site. Nothing's been determined yet. They've been looking in all the grad regions trying to set one of those up. I expect to hear something pretty soon. I think really the amount of vaccine that's on hand is going to be the limiting factor to that again. Secondly, I had a conversation with my good friend Reverend Lewis about mobile sites, mobile vaccination facilities, kind of like what we had when we took testing facilities into our neighborhoods. And I'm working and trying to emphasize how important that is. Hopefully, once we get an abundance of vaccine, we'll be able to do that. Last, let's talk about the mutant strain, the new strain of COVID-19 that we've all heard about. I am assured that while the mutant strain, the deviant strain, is 70% more transmissible, so it's more infectious than the original strain, that the tests we have for it are still good because it tests the protein coat. The vaccines are still valid. I have heard that the effects are a little less virulent than the original strain, but there is no real data to carry that out or to say that's true or false. So that's pretty much an update. That's a whole lot of stuff that to go in. I don't mind if you want to call me here at the Daviess County Courthouse with your questions. You're certainly welcome to type them into the chat box, and I'll try to get them answered while Chad is talking. But right now, it's my distinct pleasure and honor, as he has done with me on the radio stations in the past. Actually, I would have just introduced you the way you do me. It's Chad Benefield, my good friend. And Chad is here today, again, as I said, to talk to us and tell us what it's like for someone who's a young person to contract the virus, and what did you go through? And if you had, if I asked you the question, Chad, is it real or is it a conspiracy? What would your answer be?
Well, so you already know what I think about conspiracy theories. That's ridiculous. Yeah, it's real. And I have to say, first of all, let me just thank you for calling me a young person, because I'm 49.
Oh, well, that's a lot younger than the 73 that sits in front of you.
But I will preface this whole conversation with saying, honestly, I probably am in as good a shape as somebody in their late 20s or early 30s. I mean, I take really good care of myself, and I work out. I never get sick. I couldn't tell you the last time that I had the flu or a cold or a stomach virus. But on December 28th, that was a Monday, I did my morning show at the radio station, and I was supposed to be at the Owensboro Museum of Science and History because I was going to be the MC for their virtual New Year's Eve balloon drop. So I met Kathy Olson down there, my buddy Chad Gesser from Prof G Entertainment, and went in at noon to film all the stuff that I needed to film for the program that was going to air on New Year's Eve. Well, when I was in there, I kept saying to Chad, I'm like, gosh, it's cold in here. And I never get cold. Like, I mean, I'll wear shorts when it's 30 degrees outside. I don't care. So when I got home, I told Kevin, I said, well, I'm freezing for some reason, and I'm going to sit down in this chair and get under this heated throw until I warm up. Well, I didn't warm up. And by about 6, I got home about 3:45 that day. By 6 o'clock, my symptoms had far outweighed just being cold. I started getting sort of those trademark body aches that were just resonating all over. Oddly enough, a lot of COVID patients have made the comment that they lose their sense of taste or smell. Didn't have that experience. But what I started to have really just after a couple of hours of infection was this overwhelming taste of metal in my mouth. Like I felt like I had been chewing on aluminum, which I know that sounds really weird. And that's a really odd thing to say, but that's what it tasted like to me. So the next 4 days, I had my test on Tuesday morning because I had a hunch that I had contracted COVID. So I went Tuesday morning to Deaconess Clinic Express to have my test. Got those results back pretty quickly. In fact, when the PA called me with the results, she said, "Well, you're probably not going to be surprised, but you have COVID-19." I said, "Trust me, I know I do, because every single cell in my body that's being affected by it, I'm feeling it." It's horrible. So, it's funny. One thing you were talking about people and conspiracies and is it real and stuff like that. One thing that I keep hearing from a lot of naysayers is that it's like the flu. The symptoms that I have had that have sidelined me have had nothing to do with the flu. And what's so crazy about it is there is some truth that COVID affects people differently. And like you said, I mean, I'm in good shape. On paper, I should not be having the experience that I'm having. But this is day 17 for me, and I'm still at home. I did, Al, for the first time in 2.5 weeks. I washed my hair for you today.
Thank you.
It's tea tree.
Hey, what's up there looks good.
Tea tree if you want to lean in and sniff. But I'll tell you, my worst symptoms, and this is going to sound so weird, but the Messenger Inquirer did a story about it, and they tried to relay it. And I did a story on my website on our app, and I tried to share it with people. But I had this random symptom, and it started on the morning of New Year's Eve. I had not been able to sleep. In fact, at one stretch, I went 40 hours without sleeping at all. I was miserable. I couldn't. And this is not an exaggeration to say that there were 2 different times that I was sitting in the floor of the bathroom, because I did have nausea as a side effect, and I had major nausea, which ended up being a good thing because it broke the migraine I had for 48 hours. That's the only thing that broke that. But there were 2 different times when I was literally laying in the floor, being a person who's in really good shape, and I did not have the strength to get up. In fact, for about half an hour on the 30th, I sat in the floor of the half bath in my house, and I kept saying to myself, "Get up, get up. You've got to get up." And it was so hard to pull myself off the floor. I didn't have the energy. So the morning of New Year's Eve was very early in the morning, about 2 o'clock in the morning. I had to do my show. I had not stopped working. Luckily, I have the capability of working from home, even though it's been a chore. I fell asleep for about an hour on the couch. And when I woke up, I could tell that I had a fever. You know how that is. If you have a fever and you wake up and you're just like laying in a pool of sweat and stuff. But when I sat up, I could tell that my skin felt differently. Like I could immediately tell that something was different with my body. And at the time, the sensation was from my waist up to about my neck. So my torso and my back. And the way that I described it to the newspaper and in my story that I shared on our website was, imagine having an acupuncturist take needles and stick them in every centimeter of your body. And then, for fun, start hitting them with a hammer. For whatever reason, I had this reaction, and it's totally caused by the virus, where the nerve endings all over my body were heightened to the fact that to the point where I felt like, I kind of felt like a burn victim without the burns. But you know, when you see folks who've had major burns, they get skin grafts, and you see how their body adapts to that grafted skin. It becomes very tight and taut, and you can't like really move. That's how I felt. And that sensation lasted for 24 hours. And it was so bad. I was still having cold chills. I tried to put on a hoodie, like I'm wearing today, like a hoodie just like this. It hurt so badly when I got it on, I had to rip it off. And so for about 24 hours, I literally had to sit like this, where nothing could touch my skin. In fact, I was sitting on a couch, and I have a super comfortable sectional in the other room. If I leaned back against the couch, it felt like somebody was taking a knife and sticking it into my back. That's how sensitive my skin was. And that lasted really without relief for 24 hours. It carried over onto New Year's Day. And then by January 2nd, it had started to subside to the point where I actually felt comfortable again. It was the strangest thing.
You know, Chad, I am familiar being married to Judy of what being hit with a hammer feels like. The pounding of pins in, I don't know, but getting hit in the head with a hammer, yes. Those symptoms that you describe almost sound like the shingles. I remember my dad, when he had the shingles, he couldn't stand to have anything touch his skin where the outbreak had occurred. Yeah. Okay. So what you're describing right now, a lot of it was described by Kelly Thurman. I mean, and his biggest complaint was, and we interviewed him and Sharon 3 months after they had it, and neither of them had gained back their strength. As a matter of fact, Sharon was on oxygen and was going to the doctor to check. But my niece had it. One of my many nieces had it. The only symptoms that she had a migraine for 24 hours and she lost her sense of taste and smell. Look, it sounds like, or seems from the people I've listened to, sense of taste and smell, you end up not having as bad of symptoms. But then there are people like you who just, I mean, they go through the entire thing and they really, really get whacked. Just stop where you're at, because there's more to this story than you've been letting on, I'm sure. And the other thing, it may have been Kevin in there just whacking you with a hammer since he had the chance to do it. But we did have a couple of questions. It says, any news on the availability of the COVID-19 vaccine for those with pre-existing conditions? And the second question was, can I get the shot? I'm 65 with diabetes and high blood pressure. And both of those are answered by the governor today, in that you folks would fall into 1C, which would be anyone 60 and older would be eligible to get the vaccine. Anyone with pre-existing conditions would be eligible to get the vaccine. It's really hard. It's kind of a crapshoot as to any of these dates because it's continually evolving. As I said last week, the distribution is kind of akin to building an airplane after you've already taken off and you're cruising at 30,000 feet. Middle of February, end of February, 1st of March, somewhere around there. Certainly, if you hear that they're distributing, doesn't hurt if you call and ask. I have a pre-existing condition. Can I get in and get a shot? I don't know if they've got the vaccine. I haven't heard of anybody being turned away in those conditions. But and just a reminder, in this conversation today, we had a mayor who got his shot. He was 11 days post-shot. He came down with COVID-19. And the reminder is that until day 14 or 15, you really don't have any immunity conferred on you. I've heard of people saying, well, I got the shot and got COVID the next day. No, you didn't. You had COVID when you got the shot and the symptoms just appeared the next day. So those were two of the questions we had. Continue. Tell us some more. How you feel now? You're 17 days.
Well, as you can see, I still have a lingering cough. I've carried this cough for about 17 days. It has subsided substantially, but it was violent and dry and very powerful. In fact, if I went outside, I've got 3 dogs running around. So if I took the dogs outside and I would have a coughing fit outside, it was so loud and so violent. I could hear my cough slapping off the houses of the neighbors. I mean, it was pretty significant. Fatigue is still a big one. And again, I can't stress this enough. I'm not a person who needs sleep even. I sleep about 5 hours a night. I'm on the go constantly. The fatigue has really done a number on me. I was going to try to go back to the office tomorrow. But I just called some members of my staff. I said, there's no way I can come back tomorrow. I don't have the stamina to do it.
Knowing Angel, I wouldn't go back until I can fully defend yourself. I mean, I would.
Right. You know, you were talking about the Clay Horton earlier. I want to give a shout out to the Green River District Health Department. They're doing a phenomenal job in contact tracing and actually studying the folks who test positive. You know, there are all these, you mentioned conspiracy theories. People say, oh, the numbers are inflated. No, they're really not. In fact, I will say that the bookkeeping by the health department officials, phenomenal. And I will also say this, and really it's your duty if you're somebody who tests positive, really the burden doesn't fall on the health department to do your contact tracing for you. It really is your responsibility. And this is going to sound kind of morbid, but I've always been fascinated by disease. And I read books about Ebola and Marburg syndrome and these. I'm fascinated by it. I always have been. And because of that, like, I understand the importance of epidemiology and contact tracing. I mean, that's how we find out how viruses start, how they spread, and the manner in which they transmit from person to person and in what environments and stuff. So as soon as I got that positive test, I knew that I had been around a handful of people in a situation where I could have transmitted the virus. Because I came down with it on December 28th, obviously we had Christmas. I had been around my mother, immediately contacted her. I had some contact with my cousin and his wife and their 3-week-old baby, immediately made contact with them. They all did develop some sort of the symptoms. My mother actually ended up testing positive. I had gone over to do a tennis clinic at Center Court, and I was with about 6 people on the Saturday morning before my symptoms like really broke out in full force. So I contacted Noel Clayton, who, you know, conducted that tennis clinic. I said, hey, heads up, Noel, I just tested positive for COVID. I have all the symptoms. Everybody in that class needs to be aware that they were potentially exposed, because chances are 2 days before I had symptoms, I was shedding virus all over the court, right? And then the folks I mentioned from the museum, Chad and Kathy, called them immediately, because that day I was filming videos, and though they were masked for a lot of the videos that I filmed, I was not masked. And again, I didn't know it at the time, but I was shedding virus left and right. Luckily, neither one of them came down with symptoms, but that responsibility was on me to contact those folks, even though the health department did follow up and ask me who I'd had contact with. And basically I did all the work for. I said, hey, here's my list of people. Here are the folks who are now symptomatic and have tested positive, and here are the folks that I was around and potentially infected but did not. So,
okay. You know, I just had another question pop up, and the question is from a person who is scared to get the vaccine. They're trying to get as much information as they can to make a decision, and I appreciate that.
Sure.
Vaccines have been around for quite some time. I mean, the smallpox plague that continually passed through our communities for hundreds of years was in effect stopped by one of the first vaccines. You're probably I know you're too little to remember, but when I was growing up, I was a young person. In school, polio was a huge plague on all the communities, and our parents, my mom, we wanted to go swim at the sports center so bad. No, she wasn't going to allow us around those crowds. So until the polio vaccine came out, both the shot and then the sugar cube booster, in the summers, we were kept inside. Measles, mumps, and chickenpox. The vaccine that we used in my house growing up was the first kid that got it, gave it to all the other kids.
That's right.
It was a zoo with 12 kids in the house, having 12 kids scratching and itching or in dark rooms because of the mumps. And then they came out with mumps, measles, and chickenpox. I know there are a lot of anti-vaxxers out there who talk about all the bad things that happen. And yes, bad things can happen. Bad things can happen with anything. But when you compare what few bad things might happen with the good that is done for the entire community, it's a risk that I think any and every doctor will tell you is worth taking. I would suggest to this person that they talk to their physician. that you go on good sites. Don't go on some of the websites or some of the Facebook pages out there. Go to CDC, go to the Green River District Health Department, go to the Frankfurt website. There's a wealth of information on those sites, and go to them and read. And if you still have fears and concerns, talk to other people that have had the vaccine. I'm sitting here and telling you that my wife and I, without hesitation, took the vaccine. Now, that being said, my degree's in biology. I kind of understand this. I researched the way they manufactured the vaccine. They use what's called a messenger RNA to create a very little snippet of protein that induces your own immune system to create the antigens that glom onto that protein coat and render the virus inoperative and incapable of entering your own cells. I saw somebody that said, oh, it's just the way they're going to alter your DNA. No, they're not. Messenger RNA stays in the cell cytoplasm, which is the stuff outside of the cell nucleus. They don't alter your DNA. I did hear the one about the little nanodes that will allow them to track you everywhere you go. Well, I suspect the government already has that capability, so I'm not worried about that.
Can I just say, if you're making that argument that that's why you're not going to get the vaccine and you're holding a cell phone, too late.
Yeah. Amen. How many folks have been caught because they got their cell phones pinged, and you know, so I'm just telling you that from my standpoint, and my job, part of my job is to look out for the health and safety and welfare of our community, and particularly the workforce that we have here, the workforce at my private business, my own family. And I absolutely would not be afraid to recommend that they take the vaccine, and to prove its safety. I took the minute that they told me that I was eligible to get it, Judy and I went and got it. So one other question, how do we get more folks to wear masks? These case totals are high. You know, I'm not so sure that it's because of the mask more so than the large gatherings that occurred at Christmas and at New Year's. I hate to say that because we know we all have COVID fatigue. We all want to get out. We all want to run wild and act like the animals that Chad is. But you know, we're too close to the end. We have the vaccine there. So we need to wear the mask, social distance, sanitize our hands, and avoid large crowds, and particularly indoor crowds. So how do you get people to do that? I don't know. I can recommend, but we are not a communist society. We're not China where if you don't do it, we'll shoot you, and that ends that. We have free will. The only thing that we can do is continue to try to educate people, explain to people the reasons for doing that. Now, I'm going to tell you, I was at a place just this past weekend, and it was amazing. 6 foot apart, spots on the floor. Oh no, this person came right up next to me, shoulder to shoulder. I just stepped away 6 feet. The person looked at me, and I just kind of said in a loud voice that some people are idiots, aren't they? And I think the person got that message, and we went on. So how do you get them to do it? The Lord knows. We've been trying to do it since this past March, and you're absolutely right. The case totals are too high. So, Chad, tell me, where are you now? How much longer do you think you're going to be in this state?
Well, so I've made goals for myself. Unfortunately, I'm not going to achieve the goal that I set about being back in the office tomorrow. I just can't do it. In fact, I've been working since about 5 this morning because, like I said, I do have the capability of working and broadcasting from home, so I can do that. It's about nap time. I set another goal for myself, and it's a lofty one, but I think that I'm going to push myself to do it. I want to try on Saturday morning to go back to the tennis clinic. Again, lofty goal. It may not see the light of day, but I keep telling myself that's something I'm going to shoot for this week. So I've been trying to get up and walk around and move around. I can tell you, I feel as of this past Sunday and Monday, those are the first 2 days in 2 weeks that I've actually felt like a human being. And so, and today I feel pretty good too. I still have lingering effects. Oddly enough, when the health department did their assessment with me, one of the questions they asked toward the end was, well, did you have a COVID rash? Well, I didn't know what the heck that was. It was like a rash. No. Well, I'll be darned, the next day I got this huge rash. So,
well, you didn't get everything that was promised with the COVID. So they pushed that little button, the nanodes, they ended up. And folks, we're just kidding. We're just laughing about those kinds of theories.
And honestly, I've had to find some laughter because, again, on paper, I should not be having this experience. I was in New York City in the middle of March in 2020 when COVID broke out. I talked about it on my show. I flew into New York on March 10th, and I was supposed to stay through the 18th. I was out on the plane the 13th because it was basically viral ground zero. I managed to escape it then. I'm a traveler. I've still traveled. I've been very responsible. I've used gloves. I've worn masks. I've done all of my due diligence, and somehow I still got it. Don't know where. I've tried to put the pieces together about where I could have contracted it. I'm not going to know. There's no way to know. But I have been very committed to wearing that mask, not only for myself, but for my neighbors and the folks in this town. And it's so important because, like you said earlier, it is one level of defense and protection that we have. And, now I'm going to have immunity for probably 3 months. I'll still go outside with my mask on because trust me when I tell you, I sort of arrogantly thought if I got COVID-19 that I would probably it'd be a breeze for me like every other illness I've ever had. Oh gosh, I was wrong. Yeah. I was wrong.
I have some friends in the hospital right now, and it's nothing to mess around with. But what I want to know is, Kevin, we haven't heard a thing about Kevin.
Yep.
How have you guys kept it,
Well, so here's the interesting thing. He actually started showing symptoms on Sunday, December 27th. So mine broke out on the 28th. I tested positive on the morning of the 29th. He has had every symptom that I have, except the extreme nerve sensitivity. But he's had basically every textbook COVID symptom, and he's tested negative twice.
Did you use the PCR test or did you use the rapid test?
Actually, they were both. We didn't use the rapid test either time, and they were performed at two different facilities here in town. And when that test came back negative each time, the folks who administered the test and read the results said, "Look, you should assume that you are positive." And so he's been at home for 17 days too.
I know of one person that their son tested positive. Of course, they were in the house with them. One of the two tested positive and has exhibited no symptoms other than a little stuffy nose. The other person tested 3 times, finally got a positive test.
Yeah.
You just need to make that assumption. But Kevin's doing fine now.
No, still has lingering effects just like I do.
Okay.
Again, made the goal of going back to work next week.
Could have been a negative test. I mean, a false negative. Those are known to happen. I know my grandmom back in the early 60s had tuberculosis. And of course, all the family, when it was diagnosed, all of the family had to test. And my dad and I always test positive. The little skin test, we test positive. We don't have the virus. It's just, that's the way it is. So there are false positives, there are false negatives, but the false positives are very rare compared to the false positives. And that's why you need to continue. You need to treat any of those symptoms and take it seriously. just real quickly, and I don't want to involve anything that would be covered under HIPAA, and Lord knows you've got enough HIPAA for all of us.
I have no secrets.
That was awful, wasn't it? Doctor's treatment. Did your physician give you any special treatment? Did you?
Yeah. So this is interesting. Because when COVID becomes deadly, people lose the capability to breathe. In fact, I have a dear friend that I've known for years and years, who's been very involved in St. Jude fundraising, works for St. Jude, but she actually contracted COVID, and it was described by her family members and really close friends of hers that her lungs basically turned to concrete. Like, they just quit working. And so, shortness of breath is a telltale sign for COVID. Oddly enough, I have not felt short of breath, even though the morning that I went in for my test on the 29th of December, and this was about 12 to 15 hours after first showing my symptoms, the physician's assistant who was giving me the exam that morning took the stethoscope and started listening to me breathe. Well, she heard it. She said, "You have labored breathing." I didn't feel it, but I heard it. So the first thing they prescribed for me was an inhaler. Wow. And of course I thought, an inhaler? In fact, she said, "Are you asthmatic?" I said, "Not at all." And she said, "Well, you are definitely having some issues breathing." And so, and obviously there's some over-the-counter medications that we've taken too and stuff like that. I mean, but I haven't like sat down with prescription medication to battle this. I didn't really, other than the inhaler, I didn't have anything prescribed to me. But you keep seeing, I keep seeing like posts on Facebook where people, when they get diagnosed with COVID, they'll take a picture of all the stuff they have. They're going to start taking to do this. Yeah. And I've done that too. I've taken some vitamin supplements and things like that to boost vitamin D and stuff like that. And then vitamin C and zinc and those types of things. But, luckily I've been able to plow through this without like major medical attention. But I do have friends who've had to go in the hospital and had to go on ventilators. Some didn't make it off. I have a married couple friend. They got put in ICUs in separate cities, one in Owensboro, one at Vanderbilt, and they were apart for a month. It was terrible.
Yeah. Just to reiterate, you're in pretty good shape.
Yeah,
I'm in pretty good shape for 73 years old. I'm on the go. I would challenge anybody to keep up with me during a day.
Hey, I saw that gun when you got your vaccine shot. I saw that gun.
Yeah. So and your comment about taking a nap, just about ready to take a nap. Well, wait till you're 73, you'll find that's not uncommon. But just think, someone your age in top-notch shape, and then someone who are in their 60s and 70s who are not in very good shape, and how devastating this could be. Yes. And there again, while there is no guarantee, somebody asked me not too long ago, how am I going to guarantee that they're held safe by COVID? I said, I can't. I'm not. It's your responsibility. It's your responsibility to make sure you wear the mask, social distance, sanitize your hands, avoid large crowds. I can't be out there and do that for every citizen. And the fact that you wear the mask, Chad, that I wear the mask, shows my respect for you and your respect for me, and our common and mutual respect for the community. And when we go back to the question about how can we assure people, how do we get more people to do it? I think it's by setting good example. And I've said that ever since I've been in local government, that the example we set as government officials, the example we set as local government, it is a shame we can't transfer that to state and federal government sometimes. But really, that's about it. We've been on here 45 minutes. Every time I'm with you, it seems like it's no time at all. I want to thank you for coming on, for sharing your story. I think it's very important that folks understand it's not just old people that get it. And I want to tell you that we've had several folks who have passed away who are under the age of 50.
Oh, yes.
So it is extremely serious, and you need to take it that way, because first of all, we don't know the effect on those people that they call long haulers, the people who continue to suffer symptoms, who have lung damage, heart damage, and even damage to their brain for long periods of time. And those folks are out there, and there is a percentage that happens to, and we won't know the effect to them, to our population, and even to our economy for another 10 or 15 or 20 years. I'm going to end it with just an answer to somebody who continually and has always talked about the flu. And while this is just like the flu, we have well, in a really bad flu year, and I'm not talking about the 1918 flu pandemic, a really bad year, and these are figures that Clay Horton gave us last week, we might have 50, 60,000 deaths as tracked by CDC. Right now, we're at 350,000. We very well could hit 400,000 deaths as a result of COVID-19 in a 12-month period. Remember, we still have 2.5 months to go before that full year has passed. Right. So folks, again, it's nothing to mess around with. While Judy and I didn't get to go to Las Vegas for New Year's, we didn't get to celebrate. I didn't get to dance her little feet off. We felt safe and secure in our own home, taking care of each other. And that is what we have to do as a community. We have to recognize that we do have a pandemic, and we have to respect the life of our fellow citizens here, and not just in Daviess County, but in our Commonwealth and in the United States. So, Chad, thanks for being with us. Hope we get together again. Tag, you're it. So now you got to invite me to your place.
Hey, thanks for having me on. I really appreciate it. And I appreciate what you're doing too. And I love that you shared the photograph of you getting the vaccine. A lot of people have been doing that, and it's so important to spread that message and how important that is. Because honestly, you mentioned vaccines earlier. If we didn't have vaccines, all of our family trees would have way less people in them.
Oh, amen to that. And but anyway, thanks for being here. Say hi to Kevin for me.
I will.
See you. Bye-bye. Folks, see you next week.